Come in.
Hi, my name is Bree, and I'm going to be your healthcare provider today. I'm going to go ahead and start off by just washing my hands real quick before we get started. Alrighty. Can I go ahead and get you to verify your name and date of birth for me, please?
Yes, my name is Charlotte Potts, and my date of birth is July 18th of 2001.
Alright, thank you. So what brings you in here today?
Yeah, I have noticed that I have some blisters on my arms, and they hurt really bad, and they're pretty painful.
Okay, can you tell me just a little bit more about the blisters and maybe some other signs and symptoms that you've been noticing?
Yeah, sure. I've been running a fever, and I have this redness on my arms with these blisters that are very painful, and they are filled with fluid, and they break and burst really easily, and then stuff comes out of them. And I can also tell that I have been super irritable recently.
Okay, have you noticed anything else about the blisters that is like not common or?
Yeah, kind of like what I said, they just break off really easily. Like the top layer of my skin on the blisters tends to just peel off.
Okay. Do you know when you did you notice when you started noticing the blisters or when they started appearing?
Yeah, I was gonna get in the shower, and I had noticed them on my arms probably about 2 days ago.
Okay. Do you mind if I go ahead and take a look for you?
Yeah, not at all.
Alright, you can just take your jacket off for me, please.
I do have a bandage from the nurse giving me a shot.
Okay. Alrighty. And they're on both arms, not just one?
Yeah, do you want to see the other arm?
It's okay.
Okay.
Alrighty. So it looks like you have blisters on that arm, and you said that you have them on the other as well. Is the area around the blister at all tender or red?
Yeah, they're very tender. When the nurse was giving me a shot, it hurt.
Okay. Do you mind me asking where you work?
Yeah, I work in the hospital in the peds unit.
Okay. So have you come across any baby or small children that has had an open wound or sneezed or coughed on you at all?
Let me think. Yes, the other day I was holding a little girl who had an open blister on her arm.
Okay. And then do you have any cuts or breakage of the skin on your arms at all?
Yeah, I do have a cut on my arm.
Okay. So Charlotte, it looks like that what you might have is called scalded skin syndrome, which is most common in babies and children, but because you work with them, it seems as you have caught it as well. And then scalded skin syndrome is mostly acquired by direct and droplet contact, which looks like you were exposed with direct contact.
Oh, no, really? I didn't even know that the baby had that. Oh my gosh.
Yeah, it's kind of hard to tell when a baby does have it, but it's okay. We're going to go ahead and get you started with some antibiotics, and we're even going to take just a biopsy of one of the blisters to make sure that's exactly what it is, but
Okay.
It seems like that's what it is. Are you allergic to any medications or anything else that we should be aware of or we should know?
I have no allergies that I know of or anything that I think that you should be aware of.
Okay, so I'm going to go ahead and get you set up with some immediate symptomatic antibiotics. We're also going to give you some cream and ointments and then bandages for those blisters that you can apply so they can start healing properly as well, and help relieve some irritation you may be having.
Okay, thank you so much. I really appreciate it.
Of course. Are you also experiencing any pain besides the discomfort from them?
Yeah, there is a little bit of pain.
A little bit? Okay, so we can also prescribe you some pain medication if you'd like that as well.
No, it's not that bad. I think I'm okay.
Okay, perfect. So you should start to see it clear up within the next 24 to 48 hours with the antibiotics. But the blisters might take a good 9 to 10 days to clear up completely. Is there any other questions you have for me? Any other concerns?
Yes, I do have a couple questions.
Okay.
I'm just wondering, how do I prevent this from spreading to other people?
Okay, so because you do work with children, and the children that you work with are more susceptible to this skin syndrome, it might take a couple days. I would recommend taking a couple days off of work just to make sure those antibiotics really clear the actual infection so it doesn't expose any other children to it. And that way those babies don't get it as well, and then get you treated in a timely manner, which we're doing right now.
Okay, awesome. I would hate to give the babies that sick.
Yeah. Is there any other questions I can answer for you? Anything else?
No, I think I'm okay.
Okay, awesome. So I'm going to go ahead and give you this pamphlet, It has some more information about the disease, as well as it goes more in depth about the disease, how it spreads, what the body does, the treatment I discussed with you, as well as some other resources for you if you need them.
Okay, thank you so much for your help and your time. I really appreciate it. Have a great day.
Of course, if you have any other questions or concerns, don't hesitate to call us. Thank you for coming in and have a great day.
Thank you.